Hello, everyone, and welcome. Thank you for joining us today for a really special presentation with Dr. Bob Sheeler around Supplements 101. Dr. Sheeler, just to give you a little bit of a background, he is the chair of our Emerson Medical Advisory Board, and he has a really robust background. He grew up in Washington, D.C., did his medical training at UCSD, and then he actually spent the majority of his career at Mayo Clinic, working in various positions and leadership roles there, including as medical editor of the Mayo Clinic Health Letter, which is a very prestigious, read by millions health letter. Now Dr. Sheeler is located in Arizona, where he practices functional medicine in a kind of integrative care setting and specializes in neurology and headache medicine. But Dr. Sheeler has an incredible amount of experience in working with dietary supplements, and I would say at it with a very sophisticated level. So when we asked him to really pare it down to what are the top 10 supplements that practitioners should be using in their practice, when we think about things like efficacy, safety, ease of prescription, what are the things that people can get started with if they're really new to supplements? And he's put together a really nice presentation. You're going to walk away with some great clinical pearls that you can really put into practice tomorrow, and also understanding some of the background of how these things work within the body and what patients they might be most suitable for. So Dr. Sheeler, without further ado, thank you so much for joining us today, and I will let you go ahead and take the reins. One more thing, if you have questions as we go through, feel free to put them into the questions section or the chat section. We'll be monitoring that and we'll answer questions at the end. Thanks, Dr. Sheeler.
Absolutely. So I am totally excited to be here today. I'm not new to supplements at all, but I did come there sort of the hard way. I've always been very interested in pharmacology, and I want to show you today that there are a number of supplements that if you've not really delved into this realm, that are very helpful for clinical practice, very easy to prescribe. And one of the things and recommend, one of the things that's really important about them is a lot of them have a high margin of safety. And so unlike some of the pharmaceutical drugs that we use where just a little bit more is going to make somebody sick or cause a lot of problems, most of these supplements don't do that. Most of them are very well tolerated, and they have specific pharmacologic effects that allow us to do that. So when I was at Mayo, they used to call me drug boy because I would teach pharmacology, and when I taught the clerkship for family medicine, I'd make everybody learn a lot of pharmacology. And I came to supplements a little bit the hard way. I started studying functional medicine, and I was doing a lot of integrative things like Tai Chi. And my wife studied with Dr. Andrew Weil and did integrative medicine with him. And she got very aggressive using supplements, and she started getting great results. And so I went, wow, there's probably, I knew a little bit about it, but honestly, I didn't know that much. And so I was sort of scared to go there, and I kind of poo-pooed it. It's like, oh yeah, well, that's just supplements. We have pharmacologic drugs. But in truth, if you look at any agent and you say, is it safe? Is it effective? Is it cost effective? Is it reimbursed? Is it available? You can often find out that supplements will come out the winner on some of these things. So I've put together 10 different supplements that I think might be very valuable to you in clinical practice, either if you've never used anything before or if you've just used the basic things. But also, I want to tell you some things about supplements in general, because I spent the last 3 or 4 years studying them, and I actually compound and design supplement combinations as well. And so I've gotten pretty deep into this by studying over the last several years, and we have a lot of clinical experience in our practice for multiple types of things. So we take care of people for a variety of medical problems, and we always like to offer them natural choices, because often the natural choices either appeal to many people or they're gentler and safer ways to accomplish what you're trying to do. So if a pharmacologic drug is often like a hammer, supplement is often more like a screwdriver. It just sort of fine-tunes the pathway rather than smashes the end effector molecule. So without further ado, let's get into some supplements. So first I want to talk about vitamin D. Vitamin D is one of the things I think is foundational. I think almost everybody needs extra vitamin D. It's really hard to get enough, and we're going to talk about some target ranges and where to get. One of the first things I did when I was interested in vitamin D is I got vitamin D levels on everybody in our house when we lived in Minnesota. And our 2 boys who lived in the basement and played a lot of video games, their vitamin D levels were 2 and 4. And a traditional lab will say 20 is sort of the lower limit of normal, but most of us would say 30 or 33 or so is kind of the lower limit of what you want to be getting into the therapeutic range that really helps a lot of things. And so we proved that a video screen does not actually the kind of light that will help your body synthesize vitamin D, but it really takes a lot of sunlight over a lot of skin to get decent vitamin D levels. And the vast majority of people don't get it. When we moved here to Arizona, I thought, oh, everybody's vitamin D levels will be high. But actually, when it's 117 degrees for 3 days in a row and it only goes down to 106 at night, people are really not all outside all that much getting sunlight. So the majority of people who are going to get vitamin D into the levels that really help the immune system, help cardiovascular and bone protection and things like that, need a supplement. So let's talk just a little bit here about the things that vitamin D does. So the most critical thing, and I think we've all learned this in the last year or so with the things that we've been dealing with, is that vitamin D is one of the key immunoregulatory molecules. It modulates T cells upstream before they turn into B cells and T cells, and it modulates the balance between different components of the immune system. So it not only makes it stronger, but it keeps it from overreacting to things as well. And as we know from viral infections and things we've been dealing with lately, an overabundant immune system response is something that can kill you as well. We'd seen that with influenza for years, that a certain percentage of people would have that. Vitamin D is also key for bone health. It's important for calcium absorption. There are studies that show that vitamin D sufficiency is helpful for mood. And so there's a lot of the population that has mood disorders. And as a headache specialist, there are research studies that show that repleting vitamin D will help migraines. And then vitamin D is also important for cardiovascular health. So it really is a pretty broad spectrum thing. It's easy to get with a supplement, and it's easy to measure with a lab test. So when we talk about vitamin D, there's a couple of different things to think about. There's vitamin D3 versus D2. D3 is animal-derived and D2 is plant-derived. We used to think they were equivalent, but it turns out that D3 is actually a little bit stronger. And for the folks who don't like animal-derived products, I'll tell you where the vast majority of D3 comes from. It comes from lanolin, so from sheep's wool. So they have a process where they can get it out of there. So maybe most of the sheep needed a haircut anyway. And so it's really not harming the animal source to get it from that. And then there are two forms of vitamin D. When we talk about D3 and D2, what we mostly measure is 25-hydroxy vitamin D, and that's the form that circulates in the bloodstream. And a small percentage of that is converted to 125-hydroxy, and that's the active form at the cellular level. And there are certain conditions like renal disorders where the body can't convert that you actually give 125-hydroxy, but in general, we're talking about 25-hydroxy. If you see the 125 go up, in relation to the 25, then the patient may have something like a granulomatous disease like sarcoid or histoplasmosis or cocci or blastomycosis. So target levels, I think a really good target level is 40 to 60 nanograms per milliliter. And we find that the immune system is very happy in that range, that things are in balance. You get strong effects on bone and cardiovascular protection, as well as the kinds of things we're looking for mood. The studies that came out of Europe in the last year showed that when people had infectious disease challenges, that those with vitamin D levels over 33 had much less problems with serious complications. And then some of the genomic studies that we do have shown that when vitamin D levels get over 60, you actually may decrease calcium absorption and you increase your osteoporosis risk. Vitamin D does have a high level of safety. When somebody's level gets up over 80, I say, you're really probably, starting to get into a realm where you're approaching where you may have risk, but you're probably not going to get a lot of extra benefit. That's why I try to stay in the 40 to 60 realm. But I have patients who've come in to see me because they didn't realize they were taking 2 or 3 different sources of vitamin D, and their levels were 125, 130. They didn't have any symptoms at all. So after I did my functional medicine training with the Institute for Functional Medicine, I went on and studied with another group that was very aggressive with supplements, and they told me stories where they would get many people well up above 100 and hardly ever saw toxicity. And if you read the data, only a small percentage of people in the range of 100 to 120 get that. There's really no reason to go there because it's easy to measure with a blood test. And even if people don't like going to the labs, there are a number of labs that have blood spot tests for vitamin D. So next, I'd like to move on to fish oil. So fish oil, we're looking at omega-3 fatty acids, and the two primary ones that we get in supplementation are EPA and DHA. Now, fish themselves actually have a little broader component of that, and if you eat smash fish, which is like salmon, mackerel, anchovies, sardines, and herring, 2 or 3 good meals a week, you're also getting omega-7 and omega-9 fatty acids that some people will supplement separately, and you get a lot of benefit from that. But honestly, I myself and a lot of my patients really have trouble eating 3 fatty fish meals a week. If you're a native who lives in Alaska, or you live on a coastal community, or you live in Norway, it's probably a lot easier because it's part of the culture, but you have to really make an effort to do that here. And that's why I find that the supplements are helpful. And one of the things that probably has to do, there are a lot of studies that show fish oil is a benefit, and then there's a lot of studies that show that it's not. So I think this is something that has to build up in your system over a period of time, because it creates the membranes and has a long-term effect on metabolic pathways for things like eicosanoids, which are the same things that NSAIDs work on, that it makes the inflammatory eicosanoid pathways quiet down, and the anti-inflammatory ones come more into balance. And so I think that if you're eating a whole bunch of damaging type of omega-6 oils like soybean oil and cottonseed oil and sunflower oil and corn oil and all those things, you need to cut down the omega-6s in your diet as well as build up the omega-3s, because part of it is the ratio. So when you do studies on North Americans, a lot of them are eating so much omega-6 that even if they take an omega-3 supplement, they don't get a lot of benefit. But EPA is primarily anti-inflammatory, and we're going to talk about some of the other kinds of things that it's useful for. And DHA is structural. It's a structural component of your membranes. So one of my functional medicine teachers I love the best is a functional neurologist, done a lot of research at Harvard, and he said, EPA is important to keep your inflammation down, but if you don't have enough DHA, large chunks of membranes in your brain are going to be falling off. It's like, I think I would like some of that. And so the best supplements in general have a ratio of like 3:2 EPA to DHA, but there are prescription supplements that have EPA only that get significant clinical benefits. So fish oil lowers triglycerides significantly. It's important for brain integrity and inflammation. It's been shown to have significant effects on mood, especially the depression component of bipolar disorder. It's a safe way to treat that. It has an overall anti-inflammatory effect. And then I've seen a lot of ophthalmologists and optometrists recommending vitamin D at the higher ends of the dose range, up around 4 grams a day for dry eyes. Now, there are 2 things that you need to know about giving fish oil supplements, maybe 3. One is you want to give fresh fish oil from a good company, because if fish oil goes rancid, it has a lot of oxidized molecules, and it's going to do the opposite of what you want it to do. 2, a certain percentage of people will get something called fish burp. And I think you can probably imagine what that is. It's like when you burp, you taste fish, and you might do that for several hours. And as surprising as that is, that's really not all that popular with patients. And so there's 2 things you can do about it. One, you can eat first. You can take the fish oil first and then eat. So it kind of puts a barrier in your upper stomach between where the fish oil is and any kind of stuff that would reflux. And then 2, the other treatment for that, or the other preventive for that, is to freeze the fish oil, because there are cardiologists that I've worked with that have done studies that show that the effects are good, the molecule's not damaged, and if you freeze it, you tend not to get that. And then the other thing that I've seen with fish oil is it can cause a little bit of increased bleeding tendency. So if you cut yourself shaving, you may bleed longer, you may bruise a little easier and stuff like that. So I pay attention to that, and if people are getting a lot of that, then I back off a little bit. But in general, fish oil is very well tolerated. It's uniformly available, but it's something that you want to really get a good brand from somebody like Emerson, where they curate them and they work with companies that provide high quality stuff that's tested a lot. It's not something you want to go bargain shopping for. So the next molecule I'd love to talk about is coenzyme Q10. And there are 2 forms of that. Most CoQ10 is ubiquinone, but there's also a ubiquinol form, and the ubiquinol form is more activated, and people over 50 are said to not convert it as well, and so it may be more important to use ubiquinol in people over 50. So CoQ10 is a key antioxidant. It's neuroprotective. It's a vital part of mitochondria. And we also use it a lot for migraine. So it's one of the best migraine drugs in terms of decreasing the intensity and the duration of the migraine, even though it doesn't decrease the migraine days as much. And then another critical function is there's a large percentage of the population that's on statin therapy. I always joke different specialists have different things. And so if you go see an orthopedist, you're going to get an x-ray pretty likely before they're going to shake your hand. I won't tell you what happens before you see a colorectal specialist, but you can imagine how they say hello. But statins are part of the hello from cardiology. They're just like a very densely integrated component of that. And my functional medicine buddies and I here in Arizona, a lot of times our patients, if we send them back and forth to cardiologists for stress tests and catheterizations and stuff, they end up back and forth on supplements, on statins all the time. And we usually will just capitulate and keep them on a low-dose statin, because low-dose statins are anti-inflammatory and they stabilize plaque. So if you need to stabilize plaque right away, they're a good idea, although I think there are better longer-term approaches. And then the other thing that not everybody knows about statins is that they're anti-inflammatory, but so they'll take down system-wide and vascular-specific inflammation. But if you stop them, you get a rebound effect where you actually get a higher degree of inflammation and a higher event rate for things like heart attacks and strokes and stuff. So stopping and starting statins all the time is not a good idea. So when we ping-pong our patients back and forth between the specialists we need, oftentimes we've sort of capitulated and said, okay, let's get a well-tolerated statin with some of the best outcomes like rosuvastatin, keep them on a low dose, and even just, you know, 1 tablet a week will get you that anti-inflammatory effect. So in Europe, they will often use CoQ10 along with a statin. And so the reason for that is that there's a pathway that takes acetyl-CoA and acetoacetyl-CoA, and then through 2 or 3 steps, the end product is cholesterol and CoQ10. So if you block HMG-CoA reductase with an inhibitor such as a statin, you lower your cholesterol, which is the target, and you lower specifically LDL cholesterol, which, you know, does have some important effects, although not nearly as important as controlling your glucose metabolism and inflammation levels and your overall health. But you also lower CoQ10. And so CoQ10 is a key antioxidant. And so if you lose that antioxidant, you're going to get more muscle aching, you're going to get more systemic problems, you're going to get more of the kinds of things that statins can lead to. And so I believe that it's good to support the mitochondria with CoQ10, because one of the side effects that we see a lot with statins is over the years, they lead to hyperglycemia and diabetes. And saw a perfect example of that. I went to an exercise an amazing physiology clinic, and they had a cardiologist there who was prescribing pretty standard things, as well as these great exercise programs that would actually reverse plaque. And you'd see the case studies she did over years, and people would start out with a glucose of 98 and a cholesterol of 240, and then they'd be on a statin and their cholesterol come down, and then over 5 to 10 years their glucose would go 98, 104, 111, 118, 124, 128, 132. So they'd actually get to be diabetic, and it was probably from their statin because they were losing weight and otherwise healthy. So I think supplementing with CoQ10 is a good idea. I typically use about 200 milligrams of ubiquinol. 150 milligrams is okay. 100 milligrams is good as well if patients have trouble affording it, because this is one that is a little bit more expensive. But same thing here. This is not something you want to go bargain shopping for. You want to get a good brand of this because it will be better absorbed and you'll get better levels over time. Now I want to talk about B vitamins and homocysteine. So as you get into functional medicine, you start measuring other markers that people have not checked as frequently as things like simple cholesterol and blood sugar values. And one of the things that we often will check is homocysteine. So homocysteine has optimal levels less than 10 for cardiovascular protection and less than about 6.8 for brain health. And so the upper limit of normal in most labs is 13 to 14, and there are a number of genetic components that can lead to the buildup of homocysteine, which is an inflammatory marker for brain and vascular health. And so when I'm trying to lower homocysteine and fix methylation problems, I often will want to use a broad spectrum B that has a number of different components of B, because when you look at things, people will often say, yeah, I've got the MTHFR gene, and they sometimes pronounce it in interesting ways. And there are actually two MTHFR genes. There's the one that's most commonly talked about, which is C677T. Then there's a secondary one, which is A1298C. And so, yeah, I got the MTHFR gene, and I'm going to fix that with methylfolate. Well, that is an important step, because methylfolate is a key final step in the activation of folate. But the problem is that there are a number of different factors that go into there, and there are a number of other different genes. So there's the two MTHFR genes. People at least have heard of one of them. There's MTR, MTRR. There's MTHFD1, and there's a separate MTHFD1 that lives in the mitochondria. And if you have a defect there, methylfolate won't fix it. You need folinic acid. You also need adequate choline in the diet or supplementation. And then there are other genes and other pathways that come into effect with vitamins B2, B6, and B12. And so I like to say that when you look at the MTHFR gene in isolation and say, yeah, I've got the MTHFR gene, I've tested that, I'm going to fix that. It's like watching a baseball game through a hole in the fence and just looking at the left fielder and saying, yeah, I watched that game. I really understand how baseball works. It's like, no, you don't. And so if you just test a single gene, you aren't really necessarily approaching the problem. And so that's why I like a broader spectrum supplement that has a number of things like methylfolate and specifically folinic acid, has some riboflavin, has methylated, but also adenosine or hydroxyl B12. Cyanocobalamin will work too. I just have sort of an intrinsic deference to not wanting to be giving cyanide molecules, even though it's just a trace amount. Choline is important for that. And then also vitamin C, thiamine, and then benfotiamine is an activated form of B1 that is very neuroprotective, both for peripheral neuropathy in the brain, and then para-aminobenzoic acid and biotin. So all of those things together are important in methylation. So I look for combination products that have those things in them, because I really, I'm sure that you've talked to people and you've seen people come in with their whole, giant grocery sack full of supplements, is that there are folks in my practice who do that too when they come for things like cognitive decline reversal. They're willing to take 30 supplements a day. But I don't want to give somebody 10 separate supplements to accomplish lowering their homocysteine, because that's just one of the things I want to lower. I want to lower inflammation. I want optimal vitamin D levels. I want LDL particle number to be in adequate ranges. And so with a combination of diet and exercise and healthy nutrition and targeted supplementation, you can do this. And rather than give 10 supplements, it's a lot more fun to give one. Now we're going to talk about one of my favorite amino acids, L-Theanine. So L-Theanine is a non-essential amino acid that is found in green tea. It's calming, and yet it promotes alertness. And so it increases the presence of GABA, which is an inhibitory calming neurotransmitter. And so 4 cups a day of a well-done active green tea or a supplement of EGCG in the range of 300 to 500 milligrams a day is often very calming. And I have a lot of people who will take this like 100 milligrams off and on during the day, because it keeps them calm, but it's a calm alertness. And the other thing about EGCG is that it crosses the blood-brain barrier, and it's a great anti-inflammatory. So when the brain gets an insult like a stroke or a head injury or a brain infection, there are these cells called microglia, which are a type of white blood cell that normally sort of roams around and cleans up things. So if there's a little bit of blood, they nibble that up, they can take in component parts, and the blood clears up and the scarring happens, and then it's supposed to go away. The problem is, once neuroinflammation is initiated, those microglia, instead of just like bouncing around looking for something to do, they settle down in one place and they start causing damage to the tissues around them and eating the cells there. And there are not good ways, if the blood-brain barrier is intact, for the body to send cells or large signaling molecules across to turn off the microglia once they've been activated. And I've certainly seen that. I worked with a gentleman who was 20 years my senior at one point when I was with the company, and he had a head injury and seemed fine initially. And then like 6 months later, he had rapid deterioration and dramatic cognitive decline, way faster than you would ever see with typical Alzheimer's. And so once you activate neuroinflammation, you need ways to turn that off. And EGCG is one of the molecules that will cross the blood-brain barrier and do that. And so L-Theanine is another component of green tea, and L-Theanine is the calming one. And so my wife uses lots of this in kids. She treats a lot of kids and adolescents. A good part of her functional and integrated medicine practice is pediatric and adolescent medicine. She does a lot of ADD and ADHD and finds this very helpful. And I've tried it myself sometimes, and it's pleasant. I don't like things that make me sleepy because I usually have work I need to do and stay focused and concentrate, and that's why I like this one. Okay. Now we're going to talk about tocopherols and tocotrienols, and I call this the Beyond Vitamin E slide. So we were all very excited that, you know, to give vitamin E, and vitamin D was supposed to be good for heart health. And then they did some studies, and some of the studies showed that vitamin E actually may have caused increased cardiovascular problems in certain people. And I think, well, why would that be? Because it's a great antioxidant, and that seems like it ought to protect us. Well, it turns out that there are 4 tocopherols and 4 tocotrienols. And so D-alpha tocopherol is often given as DL-alpha tocopherol when it's synthetic, so half of it's inactive. And if you flood the system with D-alpha tocopherol, then these other types of tocopherols and tocotrienols are flushed out of the system. So let's say delta tocopherol appears to be one of the strongest antioxidants and the most protective. So if you're getting a bunch of delta tocopherol, as well as some alpha, beta, gamma from your diet, from eating nuts and other things that are rich sources of this, and then you flood the system with alpha tocopherol, you're actually flushing out the protective molecules and replacing them with things that have lower efficacy. So I like the tocopherols, the mixed tocopherols for that. And then tocotrienols actually have a stronger effect on preventing the oxidation of LDL and will decrease cholesterol slightly themselves. And so this is my Beyond Vitamin E slide. These are a little more expensive than just plain vitamin E, but they're a lot better idea than just taking plain vitamin E. And people tolerate these very well. Most of the products, so for instance, L-Theanine, you're going to know if you're taking that because you're going to feel calmer and better. But this is something that will just protect you and isn't going to make you feel any different. So put this one in your armamentarium. Now we're going to talk about magnesium. And I'm not going to talk about the whole spectrum of magnesium because there's like too many choices and too many routes to go. Magnesium has a lot of benefits, but there's one type of magnesium I want to talk to you about called magnesium threonate that's just come out onto the market in the last several years. And the key thing about magnesium threonate is it crosses the blood-brain barrier in an active way rather than just passive diffusion, and it results in significantly higher brain levels of magnesium. And that's important because CNS penetration will improve BDNF, brain-derived neurotrophic factor, which will also go up with things like HIIT training, high-intensity interval training. But brain-derived neurotrophic factor basically tells nerve cells to connect with each other, form networks, and stay healthy and alive. The thing I like the best about magnesium threonate is it improves deep sleep. So I've started measuring my sleep the last few years with a thing called an Oura ring, O-U-R-A, and it will track all the different stages of sleep and give you sleep scores and resilience scores and what time of your night your heart rate, you know, bottomed out and what your heart rate variability is and things like that. But it will also show you if you woke up a lot at night and how much deep sleep you get. So deep sleep is key for long-term neurologic health because it's when the brain takes out the trash. And in the last 2 to 4 years, they've discovered a lymphatic system in the brain that opens up and sort of pulses and flushes out a lot of toxic metabolites and things like amyloid and tau proteins, and it does that during that deep sleep phase. So when I take magnesium threonate, I get a lot more deep sleep and I get a lot less interruptions in my sleep cycle. And so I found it specifically something I could measure, something I could feel, and something I could really see on biometric data. So magnesium is involved in over 300 enzymatic reactions throughout the body. It's also super good at stabilizing cardiac rhythms. Depending on the salt and the person, different magnesiums like magnesium citrate and magnesium sulfate are used as part of colon preps or used as major laxatives. But magnesium threonate tends to not have very much effect like that. So put magnesium threonate on your list of things to learn about and try, or even try it yourself if you'd like to get more deep sleep or you have long-term brain health concerns. Now we're going to talk about another individual amino acids, and the one I want to talk about is citrulline. So citrulline is an amino acid that improves blood flow. And a lot of people have given arginine for this or have given arginine and citrulline combinations, but it turns out citrulline is more upstream and more of a precursor. And if you give too much arginine, you kind of get reflex responses in the other way. Whereas if you use citrulline, you get the effects that you want that are sort of gradually modulated by the body's own processes. And so a number of years ago, when I was the Mayo Clinic Health Letter editor, we published an article about an herbal combination that had like 20 different things in it that was used for to improve erectile function. And some of these things were pretty toxic. So we wrote an article about it that said, you know, this is interesting medicine and it does, you know, an interesting supplement. It does seem to have effectiveness, but we're very concerned about the side effects. We think this is, you know, potentially serious and you shouldn't take it. It didn't have citrulline in it, just had some other herbs. And so we got like 400 inquiries. You know what all the inquiries were? Where can I get this stuff? So they didn't read what we said. It's like, oh yeah, we're concerned about this, don't take it. They said, where can we get this stuff? And so anything that improves cardiovascular and endothelial health is great for overall. It's also an important component of brain function, but things that improve erectile functions tend to lead to credit card purchases on a short-term basis. And so if you're trying to improve all of these vascular beds, citrulline is one thing that you might want to get to know. It usually has to be given in a moderately high dose, like 3 grams a day. And so I tend to use powders for things like that because I don't like to take huge capsules that are 1,000 milligrams, and I don't like to take 6 500 milligram capsules to get what I'm after. So a powder form of citrulline is something that's helpful. And now we're going to talk about glutathione, which is the body's master antioxidant. One of the things you should know is that acetaminophen depletes glutathione, and that glutathione is like the last layer of defense for cells. And so if you have mercury toxicity, the glutathione is going to be trying to protect you and isolate the mercury all the time. It's used in detoxification because it helps mobilize as well as protect things on the way out. So let's say you have a bunch of lead or mercury stored in your bone or other tissues, and you mobilize that and goes through your system. You don't want that stuff causing damage on the way out. So you will get rid of 1% of your mercury in your through your gut. It'll go out through the liver into the bile, and 1% of that will go out every day. But then a lot of it is reabsorbed in your enterohepatic circulation back into the system. So if you use binding resins to absorb it, and things like glutathione and N-acetylcysteine to mobilize and protect it in the meantime, what you want to do is get it out of the bones or other storage areas and into the stool and out of the stool to egress from your body. You don't want to redistribute it to places like your brain when it's floating around. And so glutathione is very neuroprotective. I use it in a lot of my Alzheimer's patients. It's a little bit hard to absorb, and so intravenous glutathione has done dramatic things. I've heard of people that work with older physicians who are getting Alzheimer's, and they would take intravenous glutathione 3 times a week and continue to function at a high level and practice medicine for 10 years longer than they otherwise would have. I use a lot of nasal glutathione, but in truth, some of the really good liquid liposomals, if you give them at a high dose over a longer period of time, they will build up higher cellular levels and achieve better tissue concentrations than even the IV that tends to peak and trough. Another really important thing in the last year or so is that there are 2 components of the immune system. There's the adaptive immune system with the T cells and the B cells and the antibody responses and all that anamnestic stuff. But during the acute phase of infections, there's there's the innate immune system that springs into action. And one of the key components of that is NK killer cells. Well, glutathione will boost NK killer cell activity up to 400%. So put glutathione on your list of things to know about and to use. And then I'd like to finish the talk talking about vitamin K. So for a long time, vitamin K was just K1, and K1 was used when you overdosed on Coumadin and you had to pay attention to green leafy vegetables, because if you were taking warfarin or Coumadin, then you took too many green leafy vegetables. The Coumadin's a selective antagonist of K1, so you get too much K1, then you get more clotting, or you can reverse overexuberant anticoagulation. But it turns out there's another form of vitamin K2. The two most important forms are MK7 and MK4, which is based on the length of the side chain. And a lot of K2 comes from like fermented soy products, and it's concentrated there. So K2 MK7 has interesting effects. It's good for bone. It doesn't seem to have nearly as much clotting effect as K1. But the thing that, well, if you have certain genotypes, it will decrease your risk of cardiovascular disease as much as 50%. And so, especially if you're giving high doses of vitamin D, one of the things you want to do is keep the body from calcifying coronary arteries and from getting ectopic calcifications. And if you give K2 and MK7 in balance, and I typically give around 100 micrograms of K2, but you get pretty good effects at around 50, you will often get cardiovascular protection, have improved endothelial health, and have long-term better vascular outcomes without calcification of vessels. So that's my 1 to 10 favorite supplements that I thought you should all know about. Some of them are a little more sophisticated, but all of these have a high margin of safety. All of them are things that you can start using right away. And so, following my wife's lead, when I saw all the good results she got, I started to study this just as its own database, because I had a huge pharmacologic database from my regular medicine training and my love of that. And I basically just expanded it across the border into all of these other compounds that affect receptors, they affect pathways, and you can modulate them in kinder and gentler ways. And so I feel like I have a lot more to offer my patients, and I will often give them choices between traditional and integrative medicine, and I'll spell out a plan that's got several different branches of it, a lot of which will be natural choices. So my favorite thing to say to my patients, my new patients when they come, is I say, my office is like a buffet. I tell you what I got, you tell me what you want. So I'm happy to entertain your questions, and I appreciate your kindness in coming to be with us today.
That's wonderful. Thank you so much, Bob. And I love that approach. I mean, truly integrative, because you said this earlier on. When we look at therapeutics, we look at safety, we look at efficacy, and whether it's a supplement or a drug, patients want what works. So I love that you're, putting forward a little bit of everything for your patients to really see what's a good fit for them. Okay, a couple of questions. So someone said, I thought salmon shouldn't be eaten more than once a week due to mercury. I think that the guidelines are you can have it a couple times a week, 2 to 3, depending on Atlantic versus wild, right?
Right. Wild salmon, until just recently, really hasn't had much mercury in it. If it's Pacific salmon, it may have some cadmium in it, but a couple times a week is probably fine. If you're pregnant, then you need to be a little extra cautious. But in general, salmon is sort of a medium-sized fish rather than a large predator fish. And so I don't think that applies. The anchovies, sardines, and herring are actually far enough down the food chain that they don't tend to build up things like that as much. Although a lot of my patients don't really want to eat salmon and herring. They don't want to eat anchovies and herring several times a week.
There are some good options, though. This is my naturopath chiming in here. With sardines, if you buy the boneless, skinless, I find that they're I sneak them in. I usually mix 1 can of tuna with 1 can of boneless, skinless sardines in my tuna sandwiches, and the kids don't have no idea that it's happening, although they would be grossed out to know they're eating sardines. So there's some good ways to kind of sneak it in there. And if you avoid the skin and the bones, it makes it far more, like a bigger fish that we're accustomed to eating.
Good to know.
Okay, a couple other questions on fish oil. So someone asked whether the fish burp phenomena is related to gallbladder dysfunction. Have you seen that at all?
I have not seen that specifically, and something I would have to research separately, but it's not in the realm of things that I know of as a contraindication or specific issue.
Okay, great. And another question on fish oil. Someone wrote in that they have some of their patients that experienced increased rates of arrhythmias when they were put on moderate to high amounts of fish oil. Is this something that you've seen any literature on?
Yeah, I've reviewed that pretty extensively. So at first we thought fish oil helped arrhythmia problems, but it turns out that in people with structural heart disease, sometimes it will increase it. And so, I'm a little more cautious in that group of patients if they've had like previous MI or longstanding valvular disease. So it seems to increase it in people who've had complex arrhythmias before and who have structural heart damage. But when patients notice an issue, it's easy to do a Holter monitoring study. It's also easy to find other anti-inflammatories if they seem to not tolerate it for that reason.
Great. And what do you consider to be an ideal blood level of omega-6 to omega-3? Do you have a specific target you're looking for?
Usually the profiles we do, have a bunch of different components. So I like to not have overexpression of arachidonic acid, as that's very pro-inflammatory. And so Americans will often be up in the 10 to 20 to 1 range. And so I really think of omega-6 fatty acids as sort of as industrial waste, is that they're brought out at high temperatures and extracted and added to all sorts of things. And so I think minimizing them is good. So a ratio well under 10 is good. So 3 to 1 is great, 2 to 1 is great. Very hard to achieve, and if you're out eating at restaurants and doing other things like that. If you mostly eat at home and you control your food and you bring your own olive oil and you don't order things that are fried, then when you go out, then it's possible. But if you're on the road a lot, or if you eat out a lot with your friends, people are going to use omega-6 fatty acids on you because they're cheap and they're part of the culture. But I love ratios down around 2 to 3, but they're hard to achieve.
Yeah, excellent. Just as a note, if people are interested in that, Emerson and Wellevate just brought on Omega Quant, which is a at-home finger stick test, which is a nice, inexpensive way that you can get omega testing done. It's great. Okay, do you regularly check lipoprotein A to try to differentiate between patients who have elevated lipids with more cardiovascular risk, who don't require more rigid treatment? Who do require more rigid treatment versus those who do not?
Absolutely. So I check LP little a 2 different ways. One, about 70% of our patients do advanced genomics. So we look to see if they have LP little a genes, and then we measure LP little a because there's a few people who don't have the genes that have it elevated. So, we often say half the people who have heart attacks don't have elevated cholesterol. Well, 10% or 20% of them probably have elevated LP little a. That's not only more damaging in terms of oxidation, but it seems to have pro-clotting effects. So I check that, but I don't check it every time. It's like either have it or you don't. And so once I know somebody's genes and that they've had a low one, there are certain things that I don't check all the time. And then there are other things that I check to make sure they're maintaining in range, like their lipoprotein particle numbers, and then if they have a tendency to oxidize things, their oxidized LDL. So I do check markers beyond sort of the standard cholesterol stuff, and I think LP little a is critical to check, but often I only have to check it once.
Okay, great. And what do you recommend for a B complex spectrum? Do you have a couple of other brands you could put out there that people might look at?
Yeah, there are several different ones. There's methyl CPG, which might be ortho, I think. And then one that I really like a lot is called B Replete because it has the folinic acid in it. And then if you have a patient who really has significant mood disorders or methylation problems, then I use the prescription medicine called Enlight that has higher doses of folinic acid as well as a lot of methylfolate and other things in it. So those would be the 3 that I'd use. The methyl CPG I don't think has folinic acid in it, so it's not my first choice, but it has higher doses over the counter. As a supplement, the B Replete, a little bit lower doses, but it has the folinic acid and a number of the other things they like. And then the Enlight is like a mega hammer, and that's a prescription.
Great, thank you. And what dose do you typically use for Mag-threonate to help with deep sleep?
I use about 2,000 milligrams. The standard dose is 2,000 milligrams of Mag-threonate, which is actually only 144 milligrams of magnesium. So most products are, so the threonate's a big molecule, and there must be an active transport way that pulls it across the blood-brain barrier. So most products you can use easily 300 and then up to 400 to 450 milligrams of elemental magnesium a day, although you may start to get more GI symptoms depending on how sensitive you are to it. But magnesium threonate seems to work at the 144 milligrams elemental, which is 2,000 milligrams of the magnesium. And it also comes in a powder, which I like because I don't like taking 4 capsules.
Yeah, absolutely. Okay, and another dosing question. You'd mentioned with liposomal glutathione that you've seen great results using a daily high dose. What would you consider to be at that daily high dose?
Let's see. I'd have to look up from the brands that we use, but usually they come in squirts. So the daily high dose would probably be 400 or 500 milligrams, I think. I need to check that because I've used the brands for so long that I just know the number of dosing. So I typically use the liposomal bottles that are squirt bottles, and then the high doses are like 5 to 10 squirts a day.
Great. And most of the time, the majority of glutathione products that I've seen in the market are either 50 or 100 milligrams per serving, most
Right.
commonly 100 milligrams per serving. So that probably is that 500 range, which is higher than most practitioners are using, I think. So
Right. And it's more expensive is the problem, but it really does have significant effects.
yeah, and also you would, if you use a higher dose, you're going to get a better impact on your patient. And one thing, it's so important that your patient feels different and they feel better right away. It's going to build trust and get them to really, stay on the things because they're actually helping. Someone also asked about, since glutathione can be expensive, particularly liposomal, is NAC another viable option to help try to raise endogenous glutathione production?
Absolutely. So I think NAC is a great way to raise glutathione intracellularly on a long-term basis. And I was lecturing a lot in China and working over there for a few years. And some of my friends and I were over there. We were eating glutathione like they were M&Ms. Not that we eat M&Ms all the time, but I don't think they had them over there. But we were eating glutathione with that level. We were eating NAC with that level of enthusiasm.
Yeah, wonderful. Great. Okay, what are your thoughts on ashwagandha?
I like ashwagandha. The thing I like the most about it is it's a good calming adaptogen, but my absolute favorite thing about it is that it helps get beta amyloid out of cells by a channel that's not dependent on the ApoE4 receptor. And so ashwagandha is one of the ways to break up and get rid of beta amyloid. So I love it for brain health, and I also find that it can be very calming and helpful for people who are having stress.
Wonderful. I'll add it's an excellent antioxidant as well. So it's done things like improving sperm parameters too. It has so many great functions. It's definitely a favorite herb. Okay, just 2 more questions here, I think. With Mag 3 and 8, do you take that at bedtime or do you take that a couple hours before bedtime?
I take it right at bedtime because I tend to be sleep deprived enough that I don't have any trouble falling to sleep. One time I did a study and it took me like 2 minutes to fall asleep. I thought, hey, I'm like an Olympic quality sleeper. Then I took a sleep course just because I wanted to see what it was for my patients. It says if you fall asleep in less than 5 minutes, it means you're chronically sleep deprived. I went, oh, I'm probably contributing to the national sleep debt. So I don't have any trouble getting to sleep. So I take it at bedtime to help me stay asleep and get deeper sleep. But I have had colleagues who said that they have to take it, really close to bedtime because otherwise, if they take it during the daytime, they fall asleep at their desk. So that effect doesn't happen with everybody, but it's a very helpful effect to use, and that's why I use it at bedtime.
And do you use it just once a day or twice per day?
I use it once a day because I only want to be asleep during one set of interval. I don't want to be asleep earlier in the day. So.
Great. And then the last question is, what do you use for vegetarians in lieu of fish oil? Do you have other omega substitutes that you like?
Yeah, I think a lot of people are okay with krill because they don't, have conversations that we know of and are not as kind of sentient as some of the things. So I use krill oil in some of the same doses. And then you can use plant-derived things like GLA and stuff. Some of those things are converted, but at a very small amount to the omega-3 things. And so I tend to use krill for people who are more concerned about the fishes.
Great. There are some algal oils also in our catalog as well. So if you want something that's truly vegan, truly vegetarian, that would be another option, is take a look. But the problem with is that most of them are DHA, like high in DHA. It's tough to get EPA out of the algae, so, or at a dose that can really be clinically relevant. But there are some innovative things coming out too. Excellent. Okay, I think that is all of our questions. Thank you so much for your time and sharing your expertise with us. This was really wonderful, and it's really clear from the engagement people are getting ready to put these into practice right away. So thanks so much, Dr. Sheeler.
My pleasure. Thanks for having me.
Yeah, and if you're interested in learning more about these supplements or exploring brands, I encourage you to set up an account at emersonecologics.com or at wellevate.me, which is our online dispensary. We also have a staffed medical team, so if you have questions around products or around patients or cases, we are always happy to meet with you and give you some feedback on what you might be able to do. That number is 1-800-654-4432 as well. Thank you guys so much for attending. We hope you have a really brilliant rest of your week and that you can put this stuff in practice right away. Thanks again, Dr. Sheeler.
Thank you. Take care.